First, when there's a block in the coronary artery, the balloon pot open பண்ணுவாங்க. So the rectal கொஞ்சம் பெருசாயிடும். So but blood vessels like elastic rubber band, it will just close sometimes. அது prevent பண்ணதுக்கு தான் we used to put a stent. Stent means a spring. ஒரு பெனோட பால் பெனோட spring மாதிரி. அந்த spring அங்க போட்டாச்சுன்னா vessel collapse ஆகாது. அது called stent. But the stent-க்கு ரொம்ப ப்ராப்ளம் இருக்கு. Stent இருந்தாச்சுன்னா there is a 5 to 10% chance அந்த ஸ்டென்ட்டுக்குள்ளார clot வந்துடும். Stent later திருப்பி block ஆயிடும். இதொன்னும் ஸ்டென்ட் ஒன்னும் போகாம எப்படி இந்த ரெக்டகுள்ள ரிப்பேர் பண்ண முடியும்? தட் இஸ் த நியூ இனோவேஷன் ட்ரக் காட்டட் பெலூன் ஒரு மெடிக்கேட்டட் பெலூன். அதாவது ரெக்டகுள் ஃபுல் ஓப்பன் பண்ணி வச்சு அதுக்கப்புறம் இந்த பெலூன் போட்டு ஓப்பன் பண்ணிடும். இந்த பெலூன் போட the balloon is coated with a drug, a healing drug, and the drug will get smeared or get painted to the vessel wall so that திருப்பி அது பிளாக் ஆகாது, அங்க த்ரோம்போசிஸ் பண்ணாது. Secondly, if you put a stent, ஒரு ஸ்ப்ரிங் போட்டாச்சுன்னா blood vessel will dilate and contract depending upon the physiological need. Sometimes the contract sometimes like the rubber band. If you put a stent and the function போயிடும், it will be just like a PVC pipe. If you do a drug coated balloon, அது ஆகாது, அந்த பிரச்சனை இல்லை. It will respond to our physiological needs. Secondly, stent போட்டாச்சுன்னா you have to take blood thinning medicine 1 year or sometimes lifelong. So blood thinning medicine எடுத்தோன்னா சில patient will develop bleeding and some surgery you have to stop it for 5 days. Elderly people bleeding for ulcer, a lot of things can happen. இதுக்கு short course of antiplatelet blood thinning medicine needed. 3 months, 6 months is more than enough. இதுதான் இதோட அட்வான்டேஜ். ஒரு foreign body இருக்காது, அது stent related issues இருக்காது, plus the blood thinning medicine டோஸ் கம்மி பண்ணும்.
இந்த பலூன் உள்ள இருந்துட்டு இருக்குமா சார்?
இல்ல அந்த பலூன் அங்க போட்டு ஓபன் பண்ணிட்டு அந்த ட்ரக் எல்லாம் உள்ளால போச்சுன்னா balloon will deflate the balloon and take it out.
ஸ்டென்ட் போட்ட பிறகு after some time vessels will reduce சொன்னாரு கேப். அந்த பலூன் கூட reduce ஆகாது ஃபியூச்சர்ல?
இல்ல பலூன் போட்டு ஃபர்ஸ்ட் ஒரு பலூன் போட்டு ஃபுல் ஓபன் பண்ணுவாங்க. இந்த பலூன் இல்ல, ஃபுல் ஓபன் பண்ணி விட்டதுக்கு அப்புறம் இந்த பலூன். This balloon is not for opening. This balloon is to deliver the drug to the vessel wall. அதாவது எங்க இந்த மெடிசின் டெலிவர் பண்ணணும் அதனுடைய ஒரு டூல் தான் இந்த பலூன்.
எல்லா ஆபரேஷன் பண்ணணுமா இல்ல only complicated பண்ணணுமா இல்ல பண்ணணுமா?
எல்லா வெசல்ஸ்லயும் பண்ணலாம், பட் only selected. It is not an alternative to stent. Stent பண்ணித்தான் ஆகணும் சில டிசீஸ்ல, சில சைட்ஸ்ல. பட் சம்டைம்ஸ் ஃபார் எக்ஸாம்பிள் somebody had a main vessel ஒரு பிளாக் பிளஸ் ஒரு பிரான்ச்ல இருக்குன்னு நினைச்சுக்கோங்க. மெயின் வெசல் we put a stent and branchல we put a drug coated balloon. Secondly, sometimes the vessel, the rectangular size from origin to the end is not the same. It is tapering like this. So in tapering proximal part we put the stent, distal we put a drug coated balloon. Thirdly, in India there's a very high incidence of diabetes. Diabetic people who have diffuse disease, multiple disease, small vessels எல்லாம் அப்படிப்பட்ட person that stent, small stent போட்டாச்சுன்னா திருப்பி block ஆகிறதுக்கு சான்ஸ் ஜாஸ்தி. Such patients the drug coated balloons are very useful.
Lifelong sir.
This medicine, now once you open the artery, there will be some injury to the vessel wall, and the injury heal பண்ணதுக்கு தான் the healing drug கொடுக்குது. Once it is healed, the drug will disappear after 60 to 90 days. அது போதும். எத்தனை வருஷத்துக்கு இருக்கும் இந்த ட்ரக்ஸோட பவர் எஃபெக்ட்? அந்த ட்ரக்ஸோட எஃபெக்ட் இஸ் only for 60 to 90 days. அதுக்கப்புறம் ட்ரக்ஸோட எஃபெக்ட் இருக்காது, பட் அது போயிடும். அதுக்குள்ளால ஆர்டரிஸ் ரீமாடல், ஜஸ்ட் லைக் இந்த கையில ஒரு இன்ஜுரி வந்து அது ஹீல் ஆகற மாதிரி. அதுக்கப்புறம் அங்க ட்ரெஸ் ஒன்றும் பண்ண தேவையில்லை.
சோ திருப்பி அந்த இடத்துல பிளாக் ஆகாது.
திருப்பி ஆகாது.
Doctor, do we know the exact percentage of restenosis when we use a drug-coated balloon?
Exact duration, exact restenotic rate with drug-coated balloon.
The restenotic rate we are study published, and it depends on the lesion, but I would say between 5 and 10%.
Almost equal to a stent.
Almost equal to a stent. The only difference is that you do not have a foreign body, and the re-narrowing is easier to be treated because when you have a metal and the re-narrowing is more complex to treat in-stent restenosis compared to DCB restenosis.
What is the chance of a tear of the artery wall when we use a balloon over a stent? Suppose you're inserting a balloon for the second time, which is what happens when you do this. The foot must have already, the foot vessels must have already seen some kind of injury. So when you keep pushing it in, what is the chance? Does it increase the risk compared to the stent in this case? And second question, I just wanted to know what is the cost difference between a drug-eluting stent and a drug-coated balloon?
The first question, usually when you do balloon inside an old stent, the chance of having a problem are very small. So the only chance is that the result may not be so good because you have sometimes so much proliferation, so much scarring that you may even have to place a second stent, and sometimes the third time a third stent. So that's the reason why the restenosis in a stent may not be so benign and so easy to be treated. I have some unique patients that have even 4 or 5 stents, one on top of each other, because of repeated renarrowing. The second question about the cost.
Probably Indian.
In India, the cost is the same. Cost of the stent and balloon is the same. See, still this is a novel technique. This is an uncharted sea. There's a lot of research and studies going on. And Professor Colombo is also doing a lot of studies on drug-coated stents with multi-center randomized controlled trials. So we have to wait and watch for the result. The stent has been there for the past 30 years, but this also we have to see the results. But it is very, very promising, especially in Indian context,
No,
where
but
the vessels are
drug-eluting
smaller.
stents are relatively new compared to the bare metal stents. So isn't it
Drug-coated
easier
stents
to
are not new. It is there for the past 20 years.
Yeah.
Drug-coated stents are there for the past 20
And
years.
this
We know.
is for,
This is drug-coated balloons.
and this is
because
for how many years, doctor?
4 or
drug-coated
5
balloon,
years. 4 or 5
5
years.
5 years.
Yeah.
But they became more common in the last 2 years.
We need long-term data. That's only the time will tell. But there's a lot of studies going on in different kinds of patients, diabetic patients, bifurcation lesions, and calcific lesions. Lot of things.
But,
Small vessels, everything.
The result, if we do a study and we compare drug-eluting stent to drug-coated balloons, the advantage will come if it comes after 3 or 4 years. So, because the immediate results are going to be good for both, but the fact that you do not have a foreign body will be seen after 2 or 3 years. So that's the reason why these studies are complex, because every time you do a study, you want a result immediately. You have to be patient and keep on following the patient for 3 or 4 years. So the study becomes complex, expensive, and not easy, because you cannot lose follow-up from patients. Otherwise, the results become not validated.
One more thing. If you put a stent, as I said, there is 5 to 10% chance of stent clotting and then restenosis come. And then if you put and then the vessel will lose its normal physiological contractile. Everything can be alleviated, can be eliminated if you put a drug-coated balloon. Secondly, if you put a drug-coated balloon, the restenosis, because after a drug-coated balloon application and a restenosis after a stent application, it is different. It is very easy to treat a restenosis with the drug-coated balloon, but the restenosis of the stent is not very easy.
So when you see high risk of restenosis, when the artery is wide and